23 weird signs of kidney disease most people will miss. Sarah thought her constant fatigue was just from being a busy mom. The puffy eyes, too many late nights, the itchy skin, maybe a new detergent. It wasn't until her routine checkup that she discovered all these minor annoyances were actually her kidneys sending desperate SOS signals. Right now, hundreds of millions of people are living with kidney disease, and 90% have no idea. That's because kidney damage is often silent. Your kidneys can slowly stop working over 10 to 20 years before reaching end-stage kidney disease, or ESKD for short, when they lose 85 to 90% of their function. At that point, a person will need a kidney transplant or must begin dialysis. They simply cannot live without one or the other. The sooner you detect ESKD, the better you can manage it and the higher your chances of survival. Today, we'll reveal 23 surprisingly common signs of kidney disease, signs that nearly everyone, like Sarah, tends to mistake for everyday problems. We'll also give you the knowledge to know your risk factors, spot kidney issues early, and take action effectively if needed. Plus, we will give practical tips to manage those symptoms, as well as introduce some essential tests so you'll know what to expect when you visit the doctor. What you learn in the next few minutes could literally save your life. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 9 warning signs your kidneys are failing, plus tests to avoid dialysis. First, we'll explore the key warning signs of ESKD. Why is this so important? More than 808,000 people in the US are currently living with ESKD, also known as kidney failure. This is the final stage, or stage 5, of chronic kidney disease, or CKD for short. When the condition progresses to this stage, the kidneys are severely damaged and have lost most of their ability to perform their essential functions. Managing ESKD requires a combination of treatments specific to the cause and severity of the condition. Here's a quick overview of the 4 main treatment options. 1. Medications. Medications are crucial in the management of chronic kidney disease, including ESKD. They are used to help manage both symptoms and complications. For example, antihypertensive medications help control high blood pressure. Diuretics make you urinate more to reduce the accumulation of fluid in the body, and erythropoiesis-stimulating agents are given to treat anemia. Additionally, anti-hyperglycemic drugs maintain normal blood sugar levels in patients with diabetes. 2. Kidney transplant. A kidney transplant is considered the preferred treatment for ESKD. The chance to perform kidney transplant is pretty low. Over 100,000 Americans are on transplant waiting lists, with 87% of those awaiting kidneys. So, what exactly does kidney transplant do? It replaces the damaged kidney with a healthy one from a donor, and dialysis is no longer needed. This procedure offers the potential for longer survival and a better quality of life compared to dialysis. Additionally, transplants have been associated with less frequent cardiovascular disease than dialysis. However, it requires a donor match, surgery, and lifelong immunosuppressive medication to prevent organ rejection. Now that we speak about donor match, it's important to bring up a disturbing reality in China, where organs are harvested illegally and without consent, to profit from the desperate need for transplants among many people. Chinese hospitals claim they can find a matching organ within weeks, days, or even hours, while in other countries it takes years. This means these hospitals have a large number of living donors, ready to be used at any moment. The majority of these organ donors are prisoners of conscience, particularly practitioners of Falun Gong, a spiritual practice based on the principles of truthfulness, compassion, and forbearance. The victims also include Christians, Muslims, Uyghurs, Tibetans, and members of other minority groups. Their healthy organs have been taken to fuel a massive transplant business, which is backed by the Chinese government and police, and is estimated to generate $1 billion each year. If you're thinking about getting an organ transplant abroad, do not go to China. This way, you can avoid unknowingly supporting any inhumane crimes. There is so much more to this brutal story, and you can find more details and evidence in our description box. 3. Dialysis. When kidney disease progresses, dialysis may become unavoidable. It is used in the last stage of CKD when the kidneys are no longer able to effectively filter waste from the blood. Dialysis is a form of kidney replacement therapy in which its normal filtering function is replaced by artificial methods. Dialysis is performed in several different ways. One of them is hemodialysis, using a machine to filter waste from your blood outside of the body. This generally has to be done in a dialysis clinic a few times a week. Another method is known as peritoneal dialysis. A special type of cleansing fluid is placed into your abdominal cavity through a tube, and your peritoneal membrane filters out the waste products. Peritoneal dialysis offers more comfort and flexibility, as it can be easily performed overnight at home without the need for expensive equipment. 4. Lifestyle changes. Patients with ESKD can greatly benefit from diet and lifestyle changes. A kidney-friendly diet is vital to prevent malnutrition, limit the accumulation of waste substances, prevent the progression of CKD, and minimize complications. Your doctor will make recommendations based on your specific situation. You should ask about the recommended intake of protein, sodium, potassium, fluids, and phosphate for your kidney disease. Regular exercise has been shown to improve the health of patients with CKD. It was found to have beneficial effects on blood pressure, physical capacity, fatigue, heart function, and muscle health, among others. Quitting smoking is another significant way to improve your condition, because people who smoke have a higher risk of reaching ESKD than those who don't. Overall, treatment for ESKD and CKD is costly. Annual spending by Medicare in 2020 for people with CKD aged 66 years and older was $75 billion, and for ESKD, $50.8 billion. Cost analysis highlights the financial burden tied to CKD, apart from the debilitating nature of this chronic disease for individual patients. However, patients with kidney failure rarely notice changes in their kidneys or urine. You might not see differences in the volume, color, or smell of your urine. Some people might wake up more often to use the bathroom at night, but that isn't a clear sign of kidney problems. In this section, we'll explore 9 of the most common and significant symptoms of ESKD. Lifestyle changes are the safest and most effective long-term strategy for preventing and managing kidney disease. When combined with medications and other therapies, these changes help delay the need for more invasive treatments. 1. Fatigue. Ongoing fatigue is one of the most common symptoms experienced by people with severe CKD. When your kidneys don't work well, toxins and waste accumulate in your blood, and this can make you feel exhausted. Also, your kidneys make less of a hormone called erythropoietin, which helps your body produce red blood cells. Having fewer red blood cells causes anemia, which worsens fatigue. Patients with CKD who also have diabetes, high blood pressure, history of a prior heart attack, depression, or sleep problems often feel especially tired. The combination of waste buildup and anemia can make everyday tasks feel difficult. An effective solution to improve fatigue when you have ESKD is physical activity. It has been shown that patients with kidney failure who exercise more frequently experience improvements in fatigue. Some doctors like to use drugs called erythropoiesis-stimulating agents to treat anemia in ESKD, but their effectiveness for fatigue is controversial. 2. Muscle cramps. Muscle cramps are common in people with stage 5 CKD. These painful muscle spasms result from an imbalance of blood electrolyte levels, like calcium or potassium. Most frequently, leg cramping occurs when dialysis, or kidney replacement therapy, causes alkalosis, a condition in which the blood becomes too alkaline. Alkalosis leads to an imbalance in electrolytes and results in muscle cramps. Additionally, low levels of magnesium in the blood, also called hypomagnesemia, might occur after dialysis, which can also lead to muscle cramps. Patients with ESKD often experience high potassium levels. However, in some cases, potassium levels may become too low, which is called hypokalemia, Hypokalemia can result from vomiting, diarrhea, some drugs, or dialysis. Low potassium levels often lead to painful muscle cramps, too. There are effective treatments for muscle cramps in patients with ESKD. Adding magnesium into the dialysis solution has been shown to improve muscle cramping in patients with ESKD. Additionally, your doctor may suggest adjusting your current medications to help balance your electrolytes and prevent muscle cramps. 3. Swelling or edema. As your kidney function decreases and chronic kidney disease progresses, you might begin to have swelling, also known as edema, especially in your legs, ankles, and feet. When your kidneys aren't functioning properly, they can't remove extra sodium and fluid from your body. Consequently, fluid is retained in your tissues, which forms the edema. People with heart disease, impaired circulation, other kidney problems, or liver disease are more likely to experience edema. Your doctor will usually treat edema with medications called diuretics. These medications cause you to urinate more, removing some of the accumulated fluid. Another way to decrease edema is to reduce the amount of salt in your diet. Limiting sodium intake to approximately 2.3 grams per day has been shown to decrease edema. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 4. Loss of appetite and eating less. A decrease in appetite is a common problem for people with advanced kidney disease. As wastes and other toxins accumulate in your blood, some people feel less interested in eating. Loss of appetite frequently appears in earlier stages of CKD as well. However, as the disease progresses, loss of appetite becomes more significant. Other related causes of reduced appetite and food intake in CKD include oral or gastrointestinal problems, dialysis treatment, and mental health concerns. If you have diabetes and CKD, you have a higher risk of experiencing decreased appetite. Over time, diabetes can damage the nerves that regulate gastric emptying and your sensation of being full, which is called diabetic gastroparesis. You might constantly feel like you are full, even though you have not eaten recently, because food contents empty from your stomach more slowly. And if you do eat, you might develop nausea, vomiting, and abdominal pain. It is important to keep in mind that not keeping up with your nutritional needs can make CKD worse. Therefore, following the nutritional advice of your kidney specialist is essential. Doctors might recommend appetite stimulants, such as magistral acetate, to improve appetite. In these cases, monitoring adverse effects from appetite stimulants, like overhydration, excessive weight gain, and high blood sugar, is also very important. 5. Itching. Constant itching, which is called pruritus, is a prevalent symptom for people with ESKD. More than 40% of patients on hemodialysis have this problem. In some cases, it is severe enough to interfere with sleep. While the causes of pruritus are unclear, it is thought to result from the increased presence of inflammatory molecules and immune cells in the blood, an imbalance in opioid receptors, and the accumulation of toxins and electrolytes. Your doctor might treat pruritus by adjusting your dialysis dose, or by using treatments like gabapentin or pregabalin, phototherapy, or opioid receptor modulators. 6. Shortness of breath. It can be scary to feel like you cannot catch your breath. This is called dyspnea, and it is a dangerous symptom of severe kidney disease with several possible causes. Fluid, electrolyte, and protein imbalances might lead to excess water accumulation in your lungs, called pulmonary edema, which makes it more difficult for you to breathe. Scarring or hypertension in the lungs also contributes to shortness of breath. Anemia, which often accompanies kidney disease, can cause dyspnea because your body isn't getting enough oxygen. Another reason for dyspnea is the accumulation of inflammatory substances in the blood. When patients with CKD are malnourished and their inflammation levels are high, the blood becomes filled with accumulated toxins, leading to a condition called protein energy wasting syndrome. The body begins to destroy muscle tissue, including the respiratory muscles, making it harder to breathe. The best treatments are respiratory support, along with managing each specific cause. 7. Memory loss, confusion, dementia. Patients with ESKD may experience what doctors call cognitive deficit symptoms. These include trouble concentrating, memory loss, difficulty learning or making decisions, confusion, or dementia. Waste products accumulating in the blood have negative effects on cognition and brain functioning. Another potential cause is damage to the blood vessels in the brain due to a lack of oxygen. Anemia, depression, and sleep problems are additional contributors to brain dysfunction. There are some ways to prevent and treat cognitive deficits related to ESKD. Intensive control of hypertension has been shown to reduce the risk of mild cognitive impairment. Patients who receive kidney transplants are able to improve their memory after the surgery. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 8. Urine-like breath, abnormal taste. ESKD is characterized by toxin buildup, which is called uremia. This means that the fluids, electrolytes, waste substances, and other toxins that should normally be eliminated in the urine remain in the blood. Uremia may cause uremic fever, a urine-like smell of the breath. Similar to previous symptoms, when the kidneys aren't eliminating waste substances in the urine, they accumulate in the blood. In particular, high levels of ammonia in the bloodstream lead to this characteristic breath odor. Some patients also perceive an abnormal or metallic taste in their mouths, called dysgeusia. It can be due to an abnormal composition, flow, or acidity of the saliva. Fluid imbalance and electrolyte and toxin accumulation are other causes of dysgeusia. A possible solution to this problem is using mouthwash. Specifically, bicarbonate mouthwash improves the bad taste produced by the accumulation of waste substances. Since poor oral hygiene has also been reported in patients with ESKD, it is worth a checkup with your dentist to assess your oral health. 9. Skin changes. Skin discoloration and pallor, or pale skin, are present in approximately 40% of patients with ESKD, and they usually result from anemia. Other patients may experience darkening of the skin, also known as hyperpigmentation, due to hormonal imbalances. Pallor is often improved by increasing hemoglobin levels. If you are dealing with hyperpigmentation, using sunscreen will help you prevent it from worsening. Additionally, the accumulation of substances that make the urine yellow gives a yellowish tone to the skin. Very dry skin is also common in patients with ESKD, known as xerosis. The exact reason for this dryness isn't fully understood. However, it is thought to be due to shrinking and reduced functioning of the skin's oil and sweat glands, leading to dehydrated skin. Xerosis is reduced by washing your hands, showering, and bathing less frequently. Using moisturizing lotions and avoiding fabrics that make your skin irritated are also helpful measures. If skin changes are severe or troublesome, your dermatologist might offer treatments and individualized advice to help improve your appearance and comfort. Don't forget that the best way to fight CKD is to prevent it from happening in the first place. How? By recognizing the early signs. CKD is one of the fastest growing chronic diseases and a leading cause of death. Once it develops, kidney function rarely bounces back to normal. Early detection truly changes everything. CKD usually shows no symptoms in its early stages. However, an early diagnosis is possible with the help of lab tests. We'll talk about those tests soon, but for now let's focus on the early signs and symptoms you can spot at home or notice with the naked eye. 5 early signs of kidney damage you must not ignore. 10. Foamy urine. Foamy urine is when there are persistent layers of small to medium-sized bubbles in the urine seen in the toilet. Consider a single layer of large bubbles that quickly dissolve as a normal finding. It can be due to either the force of the urine flow or other normally found substances within the urine. The reason for foamy urine in chronic kidney disease is proteinuria, the presence of proteins in the urine. Proteins like albumin are typically found in the bloodstream and are not supposed to be in the urine, but they can leak out if your kidneys are damaged. Albuminuria is among the earliest signs of kidney disease and can even be seen in stage 1 CKD. However, only about 1/3 of people reporting foamy urine are found to have abnormal proteinuria. 11. Nocturia. Nocturia, which is the term for getting up to pee at night, occurs with polyuria, that is, the production of excess urine that can happen with CKD. Polyuria may be nocturnal only or occur over 24 hours. The disruption of salt and water balance with CKD can lead to either nocturnal or 24-hour polyuria. Age-related changes in circadian rhythms, which are the body's sleep-wake cycle, can also contribute to nocturia. Other causes for waking up at night to pee include diabetes, obstruction by the prostate gland, pregnancy, urinary tract infections, and more. Nocturia can be an early symptom in CKD. Research suggests that declining kidney function is associated with nocturia and correlates with increasing frequency of nocturia episodes. Kidney function is measured by how quickly your kidneys filter waste, called the estimated glomerular filtration rate, or eGFR for short. In a 2023 survey study, eGFR was slightly decreased in people with nocturia compared to those without. 12. Blood in the urine. Hematuria is another term for the presence of blood in the urine. The blood may be grossly visible, known as gross hematuria, or not visible to the naked eye, which is called microscopic hematuria. Early CKD may present with either of these. If you notice urine that is overtly bloody, red or pink, brown or tea-colored, this could be due to bleeding. Unlike gross hematuria, microscopic hematuria is not visible as a color change and is thus typically detected by a routine or incidental urinalysis. Urine dipstick and microscopic testing can help confirm your suspicion of blood in the urine. A 2018 study revealed that the presence of microscopic hematuria in patients with moderate CKD indicated an increased risk of disease progression and death during the first 2 years of testing. Participants were diagnosed with hematuria based on a positive urine dipstick test. The study also revealed that the prevalence of hematuria increased with falling eGFR levels. 13. Decreased urination. Chronic kidney disease may also be associated with decreased urine production or oliguria. Although CKD itself rarely results in low urine production, acute kidney injury in someone who already has underlying CKD is the usual mechanism. For example, this can occur if you have a chronic urine outflow obstruction contributing to CKD, and then develop urinary retention with low to absent urination. Other causes include severe dehydration, shock, or another reason for reduced blood supply to the kidneys. 14. Flank pain. Flank pain is the pain felt on the side of the abdomen, between the ribs and the hips. Pain occurs much more commonly in people with CKD compared to the general population, either due to the direct involvement of the kidneys or with associated comorbidities. Chronic flank pain is the most common symptom of polycystic kidney disease. Other diseases of the kidneys that increase your risk of CKD and may present with chronic flank pain include kidney infection, inflammation, tumors, narrowing of the vessels supplying the kidney, and other abnormalities of the kidney vasculature. Beyond the kidney, obstruction of the urine outflow pathway, such as with stones or obstruction by birth, also predisposes you to develop CKD and present with flank pain. Now that you know the early signs of kidney disease, let's talk about what happens as it progresses. Before it reaches ESKD, skin changes begin to appear, especially if your kidneys have been struggling for a while. Keep an eye out for these skin signs, and we'll also share some helpful tips to keep your skin healthy. 9 skin signs that may indicate your kidneys are damaged. Some skin changes are specific to kidney disease, whereas other changes in the skin are nonspecific and may be associated with a variety of medical problems. 15. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin thickened, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed, and a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. 16. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage in the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing, which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 17. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas such as the backs of the hands, forearms, or less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. 18. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. 1. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. 2. Dialysis. Long-term dialysis patients are more at risk. 3. Obesity. Higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. These are usually firm white nodules near joints that may break through the skin and release a white, chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 19. Dry skin, xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific, as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50 to 80% of individuals on dialysis, and here are a few common causes. 1. Poor hydration. 2. Decreased sweat gland activity. 3. High levels of vitamin A. And 4. Long-term use of diuretics. Xerosis usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. 20. Swelling. The kidneys have many functions, one of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 21. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 22. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, hair, mucosal, and nail disorders were found in 23 to 45% of the patients. On your finger or toenails, you may notice one white transverse band called Mees line, or multiple bands called Muir's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half-and-half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin, and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small, red, or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues, including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 23. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations, which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help and who to consult for these symptoms? As this video shows, some skin symptoms are more specific or serious and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. You need to make important changes to manage kidney damage. These changes include 1. Diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free, hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. That's it. Number 8 wraps up our list of 9 skin signs that could point to kidney damage. By now, you've learned all 23 surprising signs of kidney disease at every stage, from the early phases to ESKD. So if you've noticed any of these symptoms, what can you do to protect your kidneys and keep the disease from progressing? First things first, are you at high risk for kidney disease? It's important to know where you stand. Let's dive into the 10 groups most at risk, ranked from highest to lowest. This isn't just about statistics, it's about protecting yourself and your loved ones. If you see yourself on this list, we'll also cover simple and practical ways to help protect your kidneys at the end of this video. Who is most at risk for kidney disease? 10 most vulnerable groups. 1. People over 60. While young to middle-aged people, ages 20 to 60, are not usually considered high risk for CKD, the story changes greatly after age 60. A 2014 study published in the Journal of Clinical Practice revealed that about 11% of U.S. adults have CKD, and the rate is much higher in those over 60, around 39.4%. In a study in 2010, only about 2.7% of people aged 18 to 29 had kidney abnormalities, but nearly 58% of people in their 60s do. But why are older adults more vulnerable? It's largely because our kidneys naturally change with age. They lose mass, they have fewer functional filtering units, called nephrons, and their surface becomes rough. Also, blood vessels supplying them, or arteries, become hardened and narrower. With these changes, kidneys lose their function, filtering blood more slowly. As a result, blood becomes more acidic, which can contribute to dehydration and metabolic and fluid imbalances. All are not good for kidney health. Plus, oxidative stress, inflammation, and fibrosis are common in aging and play a key role in CKD development. In short, kidney health is particularly worsened by aging, and conditions like high blood pressure, diabetes, and obesity can speed up this process. For our senior viewers, the key to keeping your kidneys young is staying well hydrated and eating more antioxidant-rich and natural foods, including veggies, low-sugar fruits, white meat, and fatty fish. While some medication may help, research shows that doing exercises to improve circulation and controlling sodium intake are the real stars when it comes to slowing kidney aging. 2. People with diabetes. Diabetes tops our list as the leading cause of kidney issues. It accounts for approximately 40% of newly diagnosed CKD. In other words, about 1 in 3 adults with diabetes develops kidney disease. The link is simple. Consistently high blood sugar from diabetes causes inflammation and damages blood vessels in your kidneys over time. So, the longer someone has diabetes, or the more poorly they control blood sugar levels, the higher their risk. About 8% of newly diagnosed patients with type 2 diabetes already show signs of kidney disease through protein in their urine, also known as proteinuria. Type 2 diabetes can be more aggressive than type 1 in damaging kidneys, particularly in young people. A 2012 Canadian study that followed 342 young people with diabetes found that those with type 2 diabetes were 4 times more likely to develop kidney failure compared to those with type 1 diabetes. For people with type 2 diabetes, the risk of kidney damage increases with age and other health conditions. If you have eye problems from diabetes, also known as diabetic retinopathy, it could mean your kidneys are at a particularly higher risk too. The good news? If you have diabetes, you can reduce your risk through a careful approach. Tight blood sugar control, regular exercise, at least 150 minutes weekly, and a balanced diet low in sodium and processed foods. The goal is to keep the A1C below 7% to protect your kidneys. The A1C test shows your average blood sugar level over the past 3 months, which is different from the daily blood sugar checks you might do at home. Regular screening, or at least annually, is your best defense. Some medications like ACE inhibitors or SGLT2 inhibitors have shown promising results in protecting the kidneys in those with diabetes. And note that even pre-diabetes can start affecting your kidneys, so early intervention is key. 3. Hypertension patients. When blood pressure remains high, also known as hypertension, it damages the small blood vessels inside your kidneys, impairing their ability to filter waste from your blood and causing proteinuria. Studies reveal that hypertension is responsible for 27% of all cases of end-stage renal disease, or ESRD for short, in the U.S. People with uncontrolled hypertension, particularly those who've had high blood pressure for many years, are at a higher risk. Note that it usually takes about 10 years of uncontrolled hypertension before significant kidney damage occurs. This is actually good news. It gives people with hypertension a window of opportunity to manage their condition. Try to keep your blood pressure below 130 over 80 millimeters of mercury. Regular monitoring, at least weekly, and annual kidney function tests are essential parts of your protection strategy. Remember, while hypertension is a serious risk factor, it's also one of the most manageable ones with lifestyle changes and medications. Start by limiting your salt intake and adopting a Mediterranean diet pattern. Eat more potassium-rich foods like dairy, beans, avocados, bananas, sweet potatoes, and leafy greens to counteract the effect of salt. However, your potassium intake should be monitored under medical supervision, especially if you already have CKD. Exercise more and try to manage your stress and weight. Your doctor might prescribe ACE inhibitors or ARBs, which help lower blood pressure and reduce protein in the urine. 4. People with family history. Researchers have found certain gene changes that can lead to chronic or cystic kidney disease. So, if a close relative has one of these conditions, your chances of developing similar kidney issues can be higher. A 2009 U.S. study of over 23,000 dialysis patients found that about 23% of participants had close relatives with ESRD. Those with multiple affected family members face heightened risk. The risk is also substantially elevated for those who have a family history of both kidney disease and associated conditions like diabetes or hypertension. If kidney disease runs in your family, regular screenings are crucial. Discuss with your doctor on when to start screening. Genetic counseling can also provide valuable insights into inheritance patterns and help develop personalized prevention strategies. Lifestyle changes can greatly affect genetic predisposition, potentially delaying or preventing disease onset, even in those with genetic risk factors. Try to maintain a healthy weight and optimal blood pressure and glucose levels, exercise regularly, and eat less sodium or processed foods. 5. People with heart disease. Heart disease and kidney disease are closely linked, with one condition often exacerbating the other. Heart disease, particularly chronic conditions like heart failure or coronary artery disease, can cause reduced blood pressure and poor kidney blood flow. A study of 6,759 Japanese participants found that those with higher heart rates experienced a faster decline in kidney function. For each increase in heart rate, the risk of developing CKD and proteinuria increased by 10% and 20% respectively. This risk is especially pronounced in middle-aged or older adults or those with severe heart failure, unstable cardiac conditions, or multiple cardiovascular complications. For kidney protection in those with heart disease, maintaining stable cardiac output and blood pressure is essential. Regular monitoring should include blood pressure measurements, heart rate tracking, and periodic kidney function tests such as eGFR and proteinuria tests. A vital consideration for people with heart disease is the careful balance of medications. Some heart disease medications, like spironolactone, can affect kidney function, so it's essential to have regular checkups and adjust dosages if needed. Make sure you stay connected with both your cardiologist and nephrologist to keep both your heart and kidneys in check. To keep these two organs healthy, the most important thing is to stay active. Choose exercises that match your cardiac capacity, with a focus on low to moderate intensity. Combining the DASH and Mediterranean diets can also be really helpful. These diets emphasize antioxidant-rich natural foods like whole grains, lean proteins, and plant-based foods that are gentle on your kidneys, while keeping an eye on potassium, sodium, and phosphorus. And don't forget omega-3 fatty acids from fish oils. In clinical studies, participants who took fish oil had a 59% lower risk of experiencing cardiovascular events, such as heart attacks or strokes, compared to those given a placebo. The blood pressure of those consuming fish oil also decreased, while that of the placebo group increased. The American Heart Association, AHA guidelines suggest a daily intake of about 1 gram of EPA and DHA in advanced CKD. The safety of this dosage is great, with only minor gastrointestinal side effects like nausea or a fishy aftertaste. 6. Obese individuals. Compared to a healthy BMI of 25, your risk of declining kidney function jumps by 18% at a BMI of 30, soars to 69% at BMI 35, and more than doubles at BMI 40. This is the data from a meta-analysis of 39 studies involving more than 5 million Americans. Even more concerning, in the US, research shows that for every 1 kilogram per square meter increase in BMI, equivalent to gaining 2 to 4 kilograms of body weight, the likelihood of developing hypertension rises by 6.8%, and the risk of diabetes increases by 8.6%. Where you carry your weight matters more than just the number on the scale. The belly fat, or visceral fat around your organs, is especially problematic compared to fat elsewhere on your body. Visceral fat increases physical pressure on your kidneys and releases harmful substances like cytokines and leptin, causing inflammation and further kidney damage. The good news is that weight loss can be transformative. A 2021 study of over 6,700 adults showed that participants in a weight loss program had a 40% lower risk of severe kidney problems and were 92% more likely to see improved kidney function compared to those who didn't participate. Focus on gradual, sustainable weight loss through regular low-impact physical activity and a balanced diet rich in fruits and vegetables. Remember, even modest weight loss can have significant benefits. It's not about achieving a perfect BMI, but about making consistent, healthy choices that protect your kidneys over time. Plus, visceral fat burning should be a focus. Try to keep your waist circumference under 31.5 inches, or 80 centimeters. 7. Heavy salt, sugar, and protein eaters. If you regularly enjoy salty snacks, sugary treats, and protein-heavy meals, your kidneys might be working overtime. High salt or sodium intake not only raises blood pressure, but also directly damages your kidneys by increasing pressure in their filtering units, triggering proteinuria and promoting scarring and inflammation. Speaking of protein, excessive intake can lead to harmful nitrogenous waste. Eating too much protein also forces your kidneys to increase their filtration rate, or hyperfiltration, potentially leading to long-term damage. High sugar intake compounds these risks by potentially leading to diabetes, hypertension, and obesity, the three major risk factors for kidney disease. Excess sugar also increases oxidative stress and inflammation. Those who regularly consume processed foods, which often combine high levels of salt, sugar, and protein, are particularly at risk due to the cumulative effect on their kidneys. So the simplest way to reduce and control your intake is cooking at home with whole and natural foods. Aim to keep your daily sodium intake under 2,300 milligrams, limit added sugars to less than 25 grams for women and 36 grams for men, and consume protein in moderation, about 0.8 grams per kilogram of body weight. For CKD patients, the 2020 KDOQI guidelines recommend 0.55 to 0.60 grams per kilograms of body weight per day of protein. Remember, you don't have to completely eliminate these nutrients, especially protein. Just be mindful of their quantities in your diet. One interesting and simple approach to do so is adopting the Mediterranean diet, which emphasizes fruits, vegetables, whole grains, and lean proteins, with moderate animal product intake, while being naturally low in sodium and sugar. This diet not only benefits kidney health, but also improves blood pressure, diabetes, obesity, and cardiovascular health. Even better, this eating style can be adapted for any stage of kidney disease, with restrictions only needed if specific lab values become abnormal. 8. Smokers or heavy alcohol users. Smoking damages the kidneys through increased oxidative stress and chronic inflammation, which impair their ability to filter waste. It also constricts blood vessels, reducing kidney blood flow and worsening the existing damage over time. A 2013 study in Nature found that for every additional 5 cigarettes smoked per day, serum creatinine levels, a marker of kidney dysfunction, increased by 31%. Heavy alcohol use contributes to CKD by elevating blood pressure, damaging the heart, and causing liver dysfunction, all of which strain kidney function. Your liver can only process small amounts of alcohol. The excess can weaken your immune system and cause dehydration, worsening kidney damage. However, studies on how alcohol affects your kidneys don't always agree. Some suggest that light to moderate drinking might be beneficial for kidneys. This may be due to the complexity of the way people drink, bioactive compounds in wine, or differences in how studies are done. Still, alcohol isn't recommended because it comes with too many risks. Even small amounts can raise your risk of death, and for many CKD patients dealing with other serious health issues like diabetes or heart disease, drinking could be even more dangerous. So, the best kidney protection strategy is cessation. Our kidneys have some capacity to heal after damage, particularly when the stressors, like smoking or heavy drinking, are removed. It starts with making positive changes. Consider joining a smoking cessation program or rehab club, or tracking your intake with a journal or smartphone app. Staying hydrated and avoiding binge drinking are critical steps for alcohol users. For women, stick to 1 drink a day, and for men, 2 is the limit. A drink means about 14 grams of pure alcohol, which equals 12 ounces, or 355 milliliters, of regular beer, 5 ounces, or 148 milliliters, of wine, or 1.5 ounces, or 44 milliliters, of spirits like vodka or gin. It's so easy to load up on antioxidants from fruits and vegetables, so don't take the risks of alcohol for a few beneficial compounds when nature's superfoods have you covered. 9. People of specific races and ethnicities. Certain racial and ethnic groups are at a significantly higher risk of developing CKD, and this disparity is rooted in a combination of genetic and socioeconomic factors. African Americans, in particular, are 4 to 5 times more likely to develop kidney disease compared to other American groups. Scientists have discovered that people of African descent can carry specific genetic variations in what's called the ApoL1 gene. Having these variations can increase the risk by up to 10 times for certain types of kidney failure. In fact, over 1/3 of U.S. kidney failure patients are African American. Hispanic Americans face about 1.5 times higher rate of ESRD than non-Hispanic Americans, although their overall prevalence of CKD is similar or slightly lower than non-Hispanic ones. Hispanics also have higher rates of obesity, diabetes, and CKD-related complications. Additionally, Asian Americans, Native Americans, particularly those from the Pima and Zuni tribes, and Pacific Islanders experience diabetes, the leading cause of CKD, more often than whites. So, if you are African American, Hispanic, Native Americans, Pacific Islanders, or Asian American, your risk for kidney disease can be higher. Regular checkups can help catch it early and prevent it from worsening. Try to maintain good blood sugar control. 10. People in polluted areas. Several studies have linked long-term exposure to PM 2.5, which are small airborne particles with a diameter of 2.5 micrometers or smaller, with an increased risk of CKD. In a 2024 meta-analysis of 22 studies with almost 8 million people, researchers found that for every 10 micrograms per cubic meter increase in PM 2.5, the risk of CKD went up by 31%. Even short-term exposure to air pollutants like PM 2.5, NO2, and SO2 can contribute to kidney disease deaths, according to a 2023 study with over 100,000 people in China. For every 10 micrograms per cubic meter increase in pollution, kidney disease deaths rose by 0.49% for PM 2.5, 1.26% for NO2, and 2.9% for SO2. Besides the risk from air pollution, exposure to heavy metals at high levels like lead and cadmium can harm the kidneys, especially in people with hypertension or diabetes. In a 2024 study with more than 55,000 participants, even low blood levels of cadmium and lead were strongly linked to increased cases of CKD. Those with the highest levels of cadmium exposure were 5.54 times more likely to develop CKD than those with the lowest cadmium exposure. Pollution hits certain groups harder: outdoor workers, children, elderly residents, and people with pre-existing respiratory conditions. The risk is also particularly heightened for those living near industrial zones or high-traffic areas, where exposure to both air pollutants and heavy metals is more common. It's helpful to track the Air Quality Index, or AQI for short, in your area. The AirNow website, run by the U.S. Environmental Protection Agency, or EPA for short, lets you see your local AQI. Aim to limit your time outside when the AQI is higher than 50, and keep windows closed during peak pollution hours. Using an air purifier with a HEPA filter at home can also help keep your indoor air clean. Consider wearing N95 masks during high pollution days, especially during outdoor activities. Stay well hydrated, as this helps your kidneys flush out toxins more effectively. Bring more plants into your home. Plants like croton, dumb cane, lady palm, peace lily, rubber tree, English ivy, and spider plants are especially good at filtering out pollutants. You've learned about the high-risk groups for kidney disease. If you're in one, it's something to consider. More than 1 in 7 American adults have CKD, but 9 out of 10 don't realize it. So, how can you find out if you have CKD? The answer is simple. Common lab tests that you can do anytime. They're easy, convenient, and could make a life-changing difference. Which test can help you detect kidney disease early? 1. Blood test. Blood tests include measuring a serum creatinine level. Creatinine is a waste product produced during normal metabolic processes. Getting a serum creatinine level allows for the calculation of your kidney's estimated glomerular filtration rate. As your eGFR goes down, your creatinine levels rise, showing that your kidneys are not filtering waste products properly. Blood urea nitrogen, or BUN for short, is another blood test that measures your kidney's ability to filter waste products. However, the serum creatinine level is a much more reliable indicator of kidney function, as it is less likely to be affected by other disease states or dietary changes. For example, malnutrition and starvation decrease BUN levels, whereas dehydration and high protein intake increase them. Fever, burns, heart failure, bleeding within the GI tract, and urinary outflow obstruction also tend to increase the BUN. Serum creatinine levels remain unaffected in each of these conditions. 2. Urine test. Urine tests to screen for CKD include checking for the presence of proteins, specifically albumin. Damage to your kidneys can cause albumin, typically found within the blood, to be lost in the urine. Determining the urinary albumin to creatinine ratio, abbreviated UACR or ACR, helps estimate the amount of protein lost. Evidence of kidney damage includes having protein or blood in the urine, an abnormal urine microscopic exam, CKD-relevant findings on kidney imaging or biopsy, electrolyte abnormalities, and a history of kidney transplant. 3. Ultrasound. This method uses sound waves to create images of the kidneys. It helps detect structural problems or irregularities in blood flow to identify patients who are at risk for CKD. Get blood and urine screening annually if you have any of the previously mentioned risk factors. Most importantly, hypertension, diabetes, or heart disease. Screening for CKD in individuals with type 1 diabetes should start 5 years after their diabetes diagnosis, and with type 2 diabetes, it should begin at the time of diagnosis. Conclusion. The most important takeaway from today's video is that recognizing and understanding the symptoms of ESKD and CKD can greatly improve your quality of life. For most patients, CKD is asymptomatic and gets diagnosed late in its course, increasing the risk of disease progression and its complications. Complications of CKD include a buildup of fluid and toxins within the body, high blood pressure, electrolyte abnormalities, anemia, heart disease, and weak bones secondary to low calcium and vitamin D levels. The onset of these complications accounts for the symptoms seen in more advanced stages of CKD, like fatigue, muscle cramps, poor appetite, a metallic taste, nausea, vomiting, weight loss, swelling around the eyes, legs and feet, shortness of breath, trouble remembering things, confusion, and even changes in your skin. Specifically, skin signs of kidney damage can be itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to non-specific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Early signs of CKD include foamy urine, blood in your urine, needing to urinate at night, urinating less, and pain in your flank. Seek immediate medical help when any of these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Besides knowing the symptoms, keep an eye out for underlying risk factors that make you more prone to developing CKD. Simply put, if someone has diabetes and high blood pressure, they're at the highest risk of kidney disease, especially if they're over 60, are obese, have heart issues, have a history of AKI, or have a family history of kidney problems. Living in a region with a high prevalence of CKD also increases your risk, as do environmental exposures. While some risk factors like age and family history can't be changed, many others are within our control. Opting for a healthy lifestyle and regular screenings are key takeaways for reducing your risk of developing CKD or progression of CKD to the point of kidney failure requiring dialysis. Get checked annually by measurement of urine protein, GFR, and blood creatinine level. Remember, it's crucial to stay in close contact with your kidney specialist and follow their advice on treatments and lifestyle changes. Whether it's through medication, dialysis, or changes in diet and habits, taking these small steps can make a big difference. Staying informed and being proactive about your health will empower you to manage kidney diseases more effectively and improve your overall well-being. We hope this information helps you or your loved ones navigate the challenges of kidney disease. Share this information with your friends and family, especially those who fall into these high-risk categories. Together, we can raise awareness, promote early detection, and help prevent the devastating impact of kidney disease. On our channel, we've shared many videos about simple lifestyle and dietary changes to help manage kidney disease. Check them out, and you'll find what foods to avoid, what to include more of, and see how small changes can make a big impact. Don't miss out on all the helpful advice. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Stay informed, stay healthy.